Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believes that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature. Hi everyone, it's back to school season and all the parents out there, I'm sure you're both excited but also concerned about your kids going back to school, mingling with their fellow friends and students. So today, I've invited Dr. Johnson to give you important advice about sending kids back to school. Doc, how do the parents protect their kids?
Here are the things that we can do, okay? So we can do the things that we have always been doing for the past 2 years. Tell them to wear their mask and only remove them when they are eating and drinking or doing vigorous intensity exercise, okay, so that they don't suffocate. Okay, number 3 is to tell them to always wash their hands. Of course, more importantly is to get them vaccinated for flu and also for COVID-19. Okay, for COVID-19, Pfizer is the one that I would recommend. Okay, so aside from this, feed them a lot of fruits and vegetables, okay? Because here's the evidence that really a high amount of consumption of fruits and vegetables can do wonders for immune system. Okay, so aside from fruits and vegetables, again, exercise at least 60 minutes every day, and of course, sufficient sleep. Okay?
So it's good. Don't stop your kids from running around in school and playing with their friends, especially running, right? So let them exercise. Doc, important question for all the parents out there. I'm sure every parent would want to supplement their kids, even if they don't supplement themselves. They will buy like vitamin C syrup and things like that because they're sending their kids back to school, face-to-face contact with other students. Doc, as a doctor and a lifestyle specialist, how would you choose and how would you recommend parents go about supplementing their kids?
I would choose a whole food supplement. Okay, so by whole food, it means that the supplement that you're giving is in a whole food form, meaning it is unprocessed and unrefined. Fruits and vegetables, that was converted into a pill form. Okay?
So, because sometimes you just can't get your kids to eat their vegetable.
Yes, that's one thing. And of course, you want your supplement to have that antioxidant punch, no? So that you get the added protection.
So is antioxidants the only thing you look for? I mean, that's usually what people see when they get a vitamin C plus zinc syrup or things like that. What other functions do you look for in a supplement when it comes to the immune system?
It should have an immunomodulatory effect.
Wow, that's a big word, Doc.
Yes. So what does immunomodulatory means? So immunomodulatory means that it makes our immune system smart. When it needs to kill off bacteria, it is vicious. But when it needs to tone down or when it needs to calm down, then it calms down immediately. Okay, so what are the supplements out there that has an immunomodulatory property? Okay, beta-glucan.
Beta-glucan,
Yes,
okay.
beta-glucan is derived from mushrooms. So yeah, you can actually feed your kids mushrooms instead.
Yeah.
Okay, green leafy vegetables. Okay, your malunggay.
Oh, malunggay.
Yes.
So malunggay supplement would be a good
Yes,
choice.
it would be a good
Or
choice.
you could make your kids' favorite tinola.
Yes, you can just feed your kids malunggay. Okay, so I would rather choose something that I cannot still a whole food supplement, but something that I cannot get from a palengke.
Okay.
Okay, I cannot get from a market. Okay, that would be your microalgae. Okay, because microalgae, of course, you cannot just get it from the river, okay, or get it from the lake outright. You have to clean it. But microalgae are really
superfoods.
They are superfoods. They are packed with antioxidants. It has an immunomodulatory effects, and they are really good. Okay, and the taste is quite good actually. Yeah, it's quite good. Okay, so yeah, that's how I would choose the supplements.
And I would recommend Simply Nature Pipa tablets because we are clinically proven to be immunomodulators. So Doc, you for yourself and your kids, your future kids, you wouldn't just like get those isolated vitamins like vitamins, zinc, iron kind of thing. You would always advise a whole food supplement instead.
Yes.
Because in your whole food supplements, you have more than just the zinc, the vitamin C, the vitamin D, and the vitamin E. You have a lot of other good stuff. So with that, we wish you and your kids a great back to school season.
CA markers.
Mataas siya. Then, nung after 3 months, nung pag-take ko ng Simply Nature, doon, naging normal na siya until now. Kahit si Dr. Johan na gulat siya kasi biglang normal agad in just 3 months, nag-normal agad yung CEA ko. 1 year and 5 months, cancer-free. Dapat may food supplements kayo, like Simply Nature, na proven and tested ko na. Oh, talagang hindi ako pwedeng mawala ng Simply Nature na yan.
2019, I was being diagnosed a cancer of my uterus. So I was shocked. Sabi ko, bakit nagkaroon ako ng ganito? Samantalang hindi ako mahilig sa pagkain. I'm sorry, basura. Started the tablet and then the powder. Tinry ko din yung yung tawag dito.
Gel?
Yeah, yung gel. Yes. It's really good. After 2 months ng aking therapy and taking PPARs, sabi ni doktora, magpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory, salamat sa Diyos. Sa 2 months ko po ng aking pag-take ng PPARs, ako po ay cancer-free.
because it's the period wherein there are many morbidities from surgery, where you can detect the morbidities from surgery, especially number one, bleeding, sometimes cardiac morbidities like heart attack can also happen after the surgery, and also because of the post-operative pain if it is not managed well.
Okay.
It can lead to a cardiac event.
Hi everyone, welcome to another very special episode of Simply Heal. Today we have Dr. Jimmy with us again. Welcome, Dr. Jimmy.
Thank you, Sir Shan, and hi to everyone.
Well, Dr. Jimmy is an oncological surgeon, and also he does more than surgeries for cancer. He does general surgery as well. So today's topic is all about going under the knife. And I think it's so wonderful that we get to speak to Dr. Jimmy as a surgeon. So Doc, I'm going to ask you all the questions that our viewers want to know about surgery. First, Doc, we are always afraid to go under the knife. And Doc, you mentioned that no matter major or minor surgery is still surgery.
I think there's no person who's not scared or even a bit scared of surgery.
Yes,
even doctors.
Even doctors.
Yes, even surgeons.
But Doc, over the years, surgery has really improved, right?
Yes, a lot.
Can you give an example of what you used to have to do and what you do now?
Nowadays, there's a rapid development in minimally invasive surgery. For example, in gallbladder surgery, before we used to do 4 to 6 inches incision under the right rib, no?
Okay, right.
To do the gallbladder surgery. But nowadays, we do 3, 4 holes only. Yeah, 4 holes.
Just 4 holes.
Yes, 3 or 4 holes to do the surgery. And sometimes we can also do it with a single incision in the umbilicus. It's called a single incision laparoscopic surgery for the gallbladder.
Wow, that's a huge change from 4 inches, 6 inches to just a single hole. So I just want to let everybody know we have this fear of surgery, but surgical procedures, like everything else in modern medicine, has improved tremendously. So when you go and see Dr. Jimmy, don't go with your old ideas of what surgery is like, right? Surgery today is very minimal, invasive. There are so many innovations. Now there's even robotic surgery.
There's
right?
even robotic surgery.
What is robotic surgery? The surgeon is in the same operating theater, or
Yes. Yes.
Then why are they using what is the robotics part of it?
Actually, the robotic technology is very advanced because it's not like what you watched before, like Voltes 5 or Diamos. There are people inside the robot doing the surgery.
Yeah.
Actually, in the same operating theater, the doctor is present, but there are robotic arms, the machine.
Oh, okay.
It is the robotic arms to do the more precise surgery.
Oh, but it's the
But
doctor
actually-
directing it.
But actually, there are studies now that let's say that in the future, even from a distance, the surgeon can perform the robotic surgery. That
Wow.
means even if you're on a vacation in a beach and you have a patient who needs surgery, you can perform the surgery there.
Wow. You know that means that you can have anywhere in the world, you can actually have the best surgeon or the best directing surgeon overlooking your surgery. So that's something we can look forward to, but not yet, right?
Not yet. There's still many challenges.
There's still many challenges, but I hope that, giving you this insight, this conversation with Dr. Jimmy, and I can see there are many questions that are going to be asked. Just keep typing your questions and we'll try our best to answer them. But Doc, I guess we want to ask some questions about what we can do, right?
Okay.
What can the patient do to make sure that our surgery will go well? But before that, maybe I will ask you this question. Is there a checklist that you as a surgeon will go through to see whether this patient's surgery is going to be difficult or complicated? I mean, are there some health issues that you will look out for? Yeah.
In general, first you have to go to the right surgeon.
Okay, that's important.
Because nowadays there are many subspecialties in general surgery. Okay, so first of all, before we put the patient under the knife, we have to evaluate the patient's overall health condition.
So that is important.
Yes, that is important because comorbidities can affect the surgery as well as the outcome of the surgery.
Oh wow, not only the surgery itself, but how effective the surgery will be. So what are the common comorbidities that we should look out for?
Most importantly is the patient's cardiac condition. So usually we ask for a 12-lead ECG to check if the patient has a cardiac problem. And sometimes you have to ask for a 2D echo to confirm if the patient has ECG findings.
Well, that makes sense because while you're cutting a person, the heart must pump, right? Or else there'll be complications. So I think that's a big, I guess, wake-up call for all of us. None of us want to go for surgeries, which means when you go for surgery, it must be something important. Which also means that I think we should always keep ourselves ready for surgery, right? Because it's like having an insurance policy, right? If something really bad happens and you need surgery, you wouldn't want to be disqualified from having surgery that would save your life. So cardio is one of them.
Yes. Second in the list is the pulmonary function.
Pulmonary.
Yes, we can assess it. Simply by auscultation, by checking the patient's clinical picture, the pulmonary clinical picture. Also, a simple chest X-ray can help us. Okay, so that we can rule out if the patient has pulmonary infection,
which is like pneumonia.
You
can develop, well, when you have pneumonia, you go for operation, and there's edema, water build up, and that's
dangerous.
That's dangerous. Look how serious Dr. Jimmy is when he said that. That's dangerous, right? So, yeah, chest, pulmonary health, which is the health of your lungs, is important for surgery. Now, what about diabetes?
Yes, it's also comorbid conditions are also important to be evaluated prior to surgery, like diabetes, hypertension, allergies, especially allergies, no?
Oh, wow.
To drugs, no? Because most surgery patients will be given antibiotics and also the anesthetic drugs. So you have to report to your doctor if you have experienced any allergies to any medication that you have taken before.
When Dr. Jimmy talks about anesthesia and drug allergies, one organ that comes to mind is the kidney. The kidney needs to be healthy in order to metabolize your anesthesia, right? So that you will wake up after the operation.
It's a routine to check for the creatinine of the patient prior to surgery to check if the kidney is healthy.
Now, doctor, we know what we need to avoid or need to be prepared for before we qualify and go for surgery. So that's a big wake-up call to all of us. Make sure your high blood pressure and all these comorbidities are simply solved. So if you want to get that out of the way while you're healthy, just type in and arrange for a consult with us, alright? PPAR tablets will definitely help with metabolic syndromes like high blood pressure, diabetes, and so on and so forth. But Doc, my next question is this. After surgery, how long before we know that we are out of the danger zone for major invasive surgeries? The first 24 hours is the most important, or?
Usually the first 24 hours is still the most important because it's the period wherein there are many morbidities from surgery, where you can detect the morbidities from surgery. Especially, number one, bleeding,
infection.
Infection sometimes it presents late after surgery, but bleeding, sometimes cardiac morbidities like heart attack can also happen after the surgery.
Because the body went into shock.
Because let's say surgery is really a destructive
process.
It's an invasive, destructive process. And also because of the post-operative pain, if it is not managed well.
Okay.
Yes. It can lead to a cardiac event.
Oh, pain can induce a cardiac event. All right. So these are the considerations, right? So first, find a great surgeon like Dr. Jimmy. Make sure your health, your cardio issues are settled. So always be prepared, right? You never know when you actually might need surgery. We hope we never need, but in the event, it will probably save your life. All right. So your patients will ask you, do they ask you how to recover faster after a surgery?
All of the patients will ask you. The number one question actually is when they can eat.
Oh, when they can eat. That's definitely a very Filipino thing.
Number two, what to eat and what not to eat.
Wow! Okay, so what's your answer for those questions?
Before, I only ask them, eat healthy foods.
So that will be vegetables and eat more vegetables, fruits, drink a lot of water, right? If you can, depending on your surgery. Yeah.
But now we have a lot of dietary supplements that can actually and are proven to improve the patient's nutrition after the surgery.
Oh, so this is something that I think we can take note of. All right. Last question before we go to the Q&A. And if you have any questions about surgery, right, just please type them down. If we can't get the answer today, we always have Dr. Jimmy to refer to and we'll get back to you. And of course, we can always schedule you with a consult with Dr. Jimmy. So, Doc, surgery. What's your last words about surgery?
I know many people, let's say all people are afraid of surgery, of course, no? They are afraid because of the perceived pain during the surgery and after the surgery. Number two, because of the pain financially.
Yes.
They're afraid of the financial burden of the surgery. And also, number three, because of the, let's say, temporary loss of function after the surgery.
So, Doc, when you mention all this, especially when it comes to finances as well, it's important to take note that you investing in your health on a daily basis so that you don't have cardio issues will mean that your surgeries will be smooth, because it's really expensive when a surgery becomes complicated.
Because of the side morbidities.
Yes, and then you may have to call in additional specialists, and the drugs and procedures and follow-up action of a complication that results from comorbidity during surgery can add up your medical bills tremendously. So the best way to save money in surgery is to go in with as strong a body as you can, right? So that the surgery is smooth, successful, and no complications, and that will help to mitigate your medical bills to the bare minimum. And of course, it helps with the recovery and with the success of the surgery as well.
So always maintain a healthy lifestyle.
Yeah, look at Doc Jimmy. You've slimmed and bulked up,
Really?
more muscular since the last time we had you on the program. So take good lead from Dr. Jimmy. Keep a healthy lifestyle so that when anything happens to you, all the medical options are available to you and at a reasonable cost and also high success rate. So without further ado, let's go to our Ask Me Anything segment.
Good evening, everybody. My name is Sheila, and we are now in the Q&A portion of. Good evening, everybody. My name. Hello, bear months. All right, and may we all say goodbye to cancer this very much Cancer Awareness Month this September. We are in the street for tonight because we are being joined by two doctors, all right, who will be answering our questions for tonight. So without further ado, I'd like to call on first our oncological surgeon, Dr. Jimmy Catapia, and of course, our lifestyle medicine doctor, Dr. Jansen Tancalalan. Good evening, Doc Jimmy, and good evening, Doc Jansen.
Good evening, Ma'am Sheila. Good evening, Doc Jansen, and good evening to everyone who took the time to listen to our discussion tonight.
Hi, good evening, everyone. Good evening, Doc Jimmy. Thank you for joining us. Thank Lord, no? You were able to join us for tonight even with your busy schedule. Yeah. Okay.
Yes, we truly appreciate it. I just want you, doctors, I just want you to know, that we are being joined not only by our viewers here in the Philippines, but also our viewers coming from Brunei, Singapore, even New Zealand. Okay. Thank you so much for registering and joining our webinar for tonight. Alright, going to our first question. Alright, I think for Doc Jenny, in which instance, Doc, is surgery a first option over chemotherapy?
In general, surgery would be the first option for solid tumors. And for solid tumors that are deemed resectable, meaning it can be removed totally without any residual tumor being left behind.
I see. Doc Johnson, would you like to add on?
Yeah, I want to ask Doc Jamie, what if, when will surgery be not an option as a first-line treatment for cancer?
If the tumor is not resectable, meaning it may be invading adjacent organs that are very critical organs and we cannot remove that together with the tumor. And also in cases of stage 4 tumors, since there are already metastases, so surgery would not be the first option. For those tumors that are not stage 4 but are locally invasive, invading adjacent organs, the first line of treatment usually is chemotherapy or radiotherapy to shrink the tumor, to make it small and to make it resectable. So the surgery will be the following treatment modality.
Alright, thank you, Doc Jimmy and Doc Jansen. Alright, another question. Oh, you mentioned this a while ago during the discussion. This is a common question. Doc, anong mga foods ang okay kainin? What foods are okay to eat during chemotherapy sessions?
Doc Jansen yan.
Doc Jansen. Arrive sa medicine, Doc.
Yeah, okay. Now it depends on the side effects of the chemo, the side effects that you experience with chemotherapy. Because sometimes, no, if you experience nausea, vomiting, so of course, foods which are highly acidic, like pineapple, okay, citrus fruits, although they are really nutritious, sometimes it's not, you won't be able to tolerate it. Because once you eat that, immediately, you will feel stomach discomfort. Okay, so not only those citrus fruits, no, coffee as well, because coffee is also acidic, that can also trigger gastritis. Okay, and sometimes this one is this tea is sort of like in between. Okay, ginger tea or turmeric tea is really good, especially for cancer, no. But sometimes patients have gastritis because of these teas. So you have to really listen to your body, no. Try to experiment in the first few days. Then if you experience something bad, okay, so try to avoid those foods. But in general, no, as a nutrition prescription for each chemotherapy patients, your diet should revolve around fruits, vegetables, whole grains, and legumes. Okay, so those 4 food categories. Okay, and special mention to certain foods, no? So like broccoli, garlic, mushrooms, especially mushrooms, because mushrooms have beta-glucans in them. So beta-glucan is an immunomodulator, okay, which can make your immune system more effective when it encounters bacteria, viruses, and it can also tone down the immune system much more efficiently when it needs to, so that you don't experience, fever or you experience joint pains or redness or flushing of the skin because of an overactive immune system. Okay, so that's how I would approach things, right?
Thank you, Doc Jansen.
Can I add? Yes,
sure,
can I add?
Of course.
Okay, yes. Actually, what Dr. Johnson said was very much true, since I cater to many patients undergoing chemotherapy. And from what I experienced, some patients can tolerate, like what Dr. Johnson said, citrus fruits. Well, some patients cannot tolerate the citrus fruits. So I think the diet for cancer patients, especially those who are undergoing chemotherapy, should be individualized. So as what Dr. Johnson said, experiment on what you can and what you can tolerate.
Yeah, very much tailored fit for each of the patients, right? I am just curious, doctors, because you've mentioned foods that are not supposed to be eaten during chemotherapy sessions, right? How about just for the benefit of our patients who will be undergoing, not yet started, okay, but will be undergoing chemotherapy? Are they supposed to? Are there foods that they are not supposed to take, and food that they should be taking before the said session?
Not really, no. The same nutrition prescription will still work. Okay, even before you undergo chemotherapy. What's important is you eat healthily, okay, and you exercise, because especially exercise, physical activity or regular physical activity, no, actually is proven to improve outcomes once patient undergoes chemotherapy. It's not really the food, it's the exercise. But unfortunately, not all cancer patients can exercise because of the pain. You know, it might be metastatic. Some patients might be feeling a lot of pain. No, some patients actually, most of them cannot even walk. Okay, so again, it has to be individualized. But it shouldn't be. You should not be sedentary at the very least. Okay, so light walking, you know, if you cannot walk, then stand up, or if you cannot stand, then sit up. Okay, and then try to work with your caregiver for passive movements. Okay, so assisted movement, like your caregiver can lift up your arms, okay, or lift up your legs, just to have some circulation. Okay, but you should not just be lying down or just sitting down. Okay, there has to be movement. Okay.
Yeah. There you go. Thank you, Doc. So, just to echo it out again, Doc, more than the food, of course, there should be a little bit of physical activities as well to prepare the patients to undergo chemotherapies. There you go. Thank you, Doc. Thank you, Doc Jensen and Doc Jimmy. All right, on to our next question. Okay. This is quite long. All right. Let me just read it. Okay, it's loading. Okay. I am a relapse breast cancer patient, HER2 positive, completed my 6 chemos in June 2020. Please advise how to have a tumor shrunk further, and will it disappear over a period of time with lifestyle changes and diet, exercise? I am now continuing treatment with trastuzumab, Herceptin, and tamoxifen and Zumeta. Okay. One more time. All right. I am a relapse breast cancer patient, HER2 positive. She completed her 6 chemos in June 2020. Her tumor in the left breast has shrunk and left lymph node has flattened. Please advise how to have the tumor shrunk further, and will it disappear over a period of time with lifestyle changes and diet, exercise? I am now continuing treatment with trastuzumab or Herceptin, tamoxifen, and Zumeta. Dr. Jansen,
yes.
Dr. Jimmy first.
Yes. Okay, I will answer in a Western medicine point of view. Since you mentioned that the patient, she's HER2 positive, and she's currently ongoing treatment with trastuzumab, no, which is a HER2 inhibitor, no, as well as tamoxifen, which is a hormonal therapy for breast cancer. So my answer to that would be to finish or complete the trastuzumab therapy. There are other available medicine aside from trastuzumab. We also have the pertuzumab now. We also have other immunotherapy regimens for suited for her case. No, so I cannot fully comment since I haven't seen her record. I haven't seen how her tumor responded to the ongoing therapy now. So, but in general, she should continue and complete the trastuzumab therapy.
Thank you, Dr. Jansen.
Yeah.
Would you like to add on that?
I concur with Doc Jamie. You should finish your trastuzumab therapy and even your tamoxifen. Usually tamoxifen is given for 5 years. You should finish that. Okay? In terms of lifestyle interventions, no, in shrinking tumors, so far the evidence has shown that it can, but only for early stage breast cancer. Okay? And by early stage, that is between stage 0 and stage 1. Okay? But for your case, if it's already relapsed, I haven't so far. I haven't seen any studies that have shown shrinking of recurrence of a breast cancer. However, no, since you're eating anyway, so might as well eat healthily. And of course, again, you should finish your trastuzumab therapy because these medications have been proven to shrink tumors. Okay, so please complete them. Okay, yeah.
Please complete the medication. Yes, yes, Dr.
I will add,
Dr.
in relation to what Dr. Johnson said, no, I have noticed from my patients that those who are eating well, those who have good nutrition, respond better than those who are malnourished. So eat well.
Eat well. There you go. Thank you, Dr. Jenny and Dr. Jansen. Right. It's a good thing that you have pointed out the actions that they need to take, no, during their. I'm just curious, Doc Jansen, during the relapse, Dr. Jimmy as well, during the relapse period, is it really a common thing to still do surgeries? Is it not only happening during the first diagnosis? Is it still common? I mean, is it still common during the relapse period?
Yes, it depends on the relapse. Is it just a local recurrence or is it a distant recurrence? Meaning, are there already metastasis to other organs?
I see. Okay.
So if it's only a local recurrence, meaning it's only at the site of the previous surgery and can easily be removed without doing any heroic surgery. So surgery would still be the first choice of treatment modality. But if the recurrence is not resectable anymore or is stage 4, then systemic therapy would be the primary consideration. Maybe just like in the case of our viewer who asked the question, maybe the recurrence is not resectable at the moment. That's why she's being given systemic therapy, the targeted therapy, trastuzumab and hormonal therapy.
Thank you, Doc. Thank you, Doc Jenny. Doc Johnson, I just really want to ask this again because you've mentioned this before in our previous webinars. Well, these medications, they kind of lead to things that we should be watching out for. Imagine just the medication for over 5 years. What illnesses are these medications lead on to?
Okay, so for the more famous side effect of tamoxifen is endometrial cancer. But it doesn't always happen, okay? However, of course, since it's another cancer, no, a side effect of a drug that is given to cancer, so we have to be vigilant, okay? We have to, since it's a hormonal therapy, in terms of the prevention of the initiation of endometrial cancer, there are lifestyle interventions that you still can do, which is the nutrition therapy or the nutrition prescription that you are currently eating. Okay, so it's the same thing, and also you have to exercise. But again, after that 5-year period, you have to go for a consult, okay, and see and monitor if you have endometrial thickening or if you have bleeding, no, intermenstrual bleeding, if you are still premenopausal, or if for women who are postmenopausal already, see if you have vaginal bleeding, no, so that would be a sign that you might have endometrial cancer. So go to your doctor immediately to get treated, okay? And even if you do get endometrial cancer is really treatable. It's not something that is a very aggressive cancer, no, so it can be treated, okay?
Yeah. It's very encouraging. Thank you, Doc Johnson and Doc Jimmy. Right, coming from another viewer, Miss Lilibet. I know someone who is stage 1 breast cancer. Nagpa-opera na siya. She's done with the surgery. Is she already safe from cancer? Doc Jimmy?
Even if it's just a stage 1 breast cancer, there's still a very small chances of recurrence. So she must also get the tumor, know the tumor characteristics, even if it's stage 1, if she will be needing chemotherapy, if she will be needing hormonal therapy. And of course, the surveillance diagnostic test should be done regularly, especially if she has symptoms. So it's even if it's just stage 1, it doesn't mean that she's already safe and she can relax. So always do a follow-up checkup to your doctor, to your oncologist.
Thank you, Doc. Doc Johnson, this is regardless of whether the patient has undergone lumpectomy or mastectomy, right? So
Yeah. Mhm.
it should still be.
Yes, yes. For stage 1 breast cancer, if you have had surgery already, please don't stop there. Okay, I mean, at least get radiation therapy, because so far, back then, no, when I was still an intern, I rotated in a radiation oncology department. So far, the patients that I have seen there, especially the consultants, my consultants back then, they always tell me that the patients that they get, no, especially for early stage breast cancer, is a recurrence, because they just had surgery done. They did not undergo radiation therapy anymore. So sometimes, so what the radiation oncology does is to irradiate the chest area and have additional radiation doses on the scar. Okay? Yeah, so that's what they do to prevent recurrence. Yeah. But of course, doctors, your oncologists will not stop with surgery and radiation therapy alone. For me, doctors tend to be, especially when they are approaching cancer, they tend to be in Filipino, it's sigurista. Okay? They don't want to take any chances. So even if it's early stage, they advise you to go for surgery, radiation therapy, and chemotherapy, and targeted therapy if needed. Okay. Yeah.
Thank you, Doc. Thank you, Doc. Actually, it's really sad that Sir Sean is not
Yes.
with us tonight because he has a very appointment tonight. No, however, I just want to echo out what he keeps on telling everyone. It's really after the surgery, that everybody or our patients should be knocking out the remaining cancer cells, not only by just taking healthy food, but also going further to the laboratories that are advised, of course, our doctors. All right. There you go. Thank you so much, Doc. Okay. Oh, another question from coming from Miss Lily. Can PPARs po help people who undergone surgery to recover faster? Dr. Johnson first?
Yes, they can, because it's highly nutritious. If you are well nourished, then you will be able to recover much faster from surgery. So again, you have to, of course, after you've undergone surgery, you cannot eat immediately, no? So this has to be done prior to surgery, okay, in preparation for surgery. Because after surgery, of course, your doctor won't allow you to eat just yet. Okay, not immediately, at least, no? Yeah.
Thank you, Doc. Thank you, Dr. Jimmy.
Yes, okay. In my experience with PPARs, after the surgery, especially if it is a cancer patient, I prescribe them with the PPAR capsules or tablets, since these two forms of PPARs have high protein content. So it will greatly add to their nutritional condition in preparation for possible chemotherapy and other treatment modalities.
PPARs does help. Thank you. Whether you are for pre-op or post-op, PPARs will greatly help. Anyway, okay. Another question coming from Ms. Maria de Cruz. Is it okay to just take PPARs for a breast cancer survivor, or would you recommend to also take other vitamins and supplements? Let's have Dr. Jimmy first.
Okay, in my experience again, okay, since I'm treating cancer patients, I do not advise them to take any other forms of vitamins anymore. I just give them either the capsule or the tablet, since these PPARs, they already have they're antioxidants, no? PPARs are antioxidants as well. They also have protein. So just combine it with a healthy lifestyle and healthy diet. So there's no need to take other multivitamins.
Dr. Johnson. Thank you, Dr. Jimmy. Dr. Johnson.
Yeah, for me, I tailor it further to the lifestyle of the patient, depending on the patient's occupation. If the patient is, let's say, for example, works night shift, or is not really does not have adequate sunlight exposure, then I prescribe additional vitamin D. But it depends on the lifestyle already. Another one that I usually prescribe, especially if you are my patient, then most of the time you'll be on a plant-based diet, is I add in vitamin B12. Okay, but so far those are just the two vitamins that I usually add in. And then Simply Nature Peepars. That's it. But the vitamin D really depends. If you are not someone or you don't have adequate sunlight exposure, then it would be in your best interest to take one. But if you are exposed to sunlight anyway, so at least 20 minutes every day for Filipinos, that would be enough already. Okay? Yeah.
Thank you, Doc. Thank you, Doc Jenny. Thank you, Doc John. You know, we always say this here in Simply Nature, right, Doc? That where if you are kind of young, if you still wish to continue on with your other supplements, you may do so alongside PPARs, because PPARs, Doc, has no contraindication with those medications. But if you want to focus on something that can really help you out, we have PPARs because it's almost completely questionable content. Okay, just like what our doctors has told us tonight. Okay, thank you, Doc. Another question coming from Ms. Rita Catabona. Good evening, everyone. Doctors just want to ask po if fecal immunochemical test done and the result is positive, what does it mean po? Thank you po. Doc Jenny?
What again, ma'am? Is the fecal?
Fecal immunochemical test. It turns out that the result is positive. What does it mean?
Sorry, I'm familiar with the fecal immunochemical.
Yes.
Is it the fecal matter that's being tested?
Miss Rita, you might want to elaborate your question further. Alright. For the meantime, while our doctors are looking for the best answer for this one, let's park that for the meantime. Let's go first to the next question coming from Ms. Rolette Galim. Okay. Question is PPARs advisable to ER/PR positive and HER2 negative breast cancer patients?
Yes.
Doc Jenny.
Yes. It's very much advisable. Actually, you have a very good cancer profile. If it is ER/PR positive and HER2 negative, we now have the what you call subtypes of breast cancer. It's called luminal A. It's ER/PR positive and HER2 negative, and it has the best prognosis among the types of breast cancer. So if you with that very good characteristic of the tumor, and then you add PPAR, then you will have a better result.
Thank you, Doc Mini. Doc Jensen? Doc Jensen, you might want to share a bit of how the PPAR protocols are being recommended.
Okay, for luminal A type of breast cancer, yes, absolutely. You will benefit from PPARs, no? Because for luminal A, usually the root cause of the root cause, no, why you develop breast cancer in the first place, it's probably because of your metabolic processes as well. You might have dyslipidemia, long-term dyslipidemia. You're eating junk foods, okay? A lot of animal food products probably, or you love drinking milk. Milk can also be a trigger. Now, for those types of metabolic diseases, PPARs is really effective. It's actually where the metabolic diseases is actually where PPARs shine. Okay? Remember, we have certain types of drugs which are PPAR agonists as well, like your fenofibrate and your pioglitazone. Fenofibrate is specifically used to treat an elevated triglyceride level. And for pioglitazone, it's an insulin sensitizer. Okay? So those two drugs work on your metabolism. It works on your metabolism, especially in the liver. Okay? So for Simply Nature PPARs, yes, it will definitely help you. If you have dyslipidemia or if you are obese or overweight, sometimes that is also one of the profiles of breast cancer patients. Actually, obesity is one of the major risk factors for developing breast cancer. So definitely, PPAR agonists or Simply Nature PPARs will definitely help your metabolic pathways or metabolism. Try to correct them. And of course, you have to also have a healthy lifestyle as well, no? While you are doing so. Okay? So, because it works in synergy. While you are doing the lifestyle change and you are taking Simply Nature PPARs or PPAR agonists, it makes it more effective. So for low dose, the effect is quite huge. Okay? So in a very short period of time, you will be able to correct those abnormal or those stars that you see inside your blood chemistry report. Okay?
The high and lows.
Yes.
There you go. Thank you, Dr. Jansen. Dr. Jimmy, would you like to add to that? Or
I already answered. Sorry.
I'm sorry. Thank you.
Yeah.
Okay.
Sheila, let's go
Yes,
back to
yes,
the
ma'am.
question, the previous question, the first one regarding fecal immunohistochemical staining. I think Doc Jimmy, the patient is asking about colon cancer, the screening for colon cancer.
Oh, the result is positive.
Yeah, the
she
result is
said.
positive, yeah. Oo.
It's called, is it the same as the fecal occult blood test?
I think so, but I'm not really sure if it's the same medical procedure or it's the same laboratory procedure.
If it's the same and it turns out to be positive, what could it mean? What could it mean?
A positive test for fecal occult blood test is the risk for colon cancer, for the presence of colon cancer, is elevated, but it's not a definitive test. The definitive diagnosis is still colonoscopy.
Yes, I agree. This is just fecal occult blood test is just a screening laboratory examination. If it turns out positive, then there's an indication to do colonoscopy.
So for colorectal cancer doctors, it's like after this fecal immunochemical test, we have to go through colonoscopy, and then furthermore, if they really see something, they really should go further for biopsy. Correct?
Yes, the biopsy.
So, there you go. I hope that answers your question, Miss Rita. Okay, and I think it would be best for you, Ms. Rita, to have a consult with Doc Jansen and Doc Jimmy as well. No? So, like we always say, it's best to have it tailor-fit, right? All the advices that we are given. Okay? All right, another question. I think that just a follow-up comment coming from Ms. Relay. For Lumina A, it is elevated estrogen and progesterone. Okay. You just mentioned. Okay,
Yes,
thank
yes.
you. Okay, another question. Okay, coming from Ms. Jen. Doc, if I am allergic to spirulina, can I still take PPARs? And what is their difference? Dr. Jansen?
Okay. If you're allergic to spirulina, then yeah, you still can take Simply Nature PPARs because those are different microalgae. Simply Nature PPARs is a special strain of chlorella. Okay, so different species of microalgae. So if you're allergic to spirulina, actually I don't like spirulina because it has neurotoxic effects. Okay, so I don't like that. Simply Nature PPARs is much more stable. And why is it that Simply Nature PPARs is more effective for these metabolic diseases, for cancer? It's because their strain has the PPAR agonists. Okay, the other species of chlorella doesn't have it, or if it does, it's quite low. Yeah.
I see. So that is the difference. Okay,
Yes, that's the
yeah.
main difference.
It's very much understandable because PPARs is always compared to spirulina because of how our tablet looks like, right? There you go. Thank you, Dr. Jimmy and Dr. Jansen. All right, another question. Okay, coming from Ms. Lily, what are the usual side effects of cancer surgery for elders? Dr. Jimmy?
It depends on the type of surgery. If it is a modified radical mastectomy, meaning you remove the entire breast as well as the axillary lymph nodes, the common side effects are number one, paresthesia. Sometimes you lose the sensation on the medial arm as well as the lateral chest wall. Another side effect would be lymphedema. Sometimes there's a swelling of the involved arm in the surgery. Also, the a limitation in the range of motion of the arm because of the scarring and scarring side effect of the surgery. So some patients will not be able to move their arms just as before the surgery.
Thank you, Doc. Dr. Johnson, would you like to add on that?
Yeah, I think Doc Jamie is have answered. Yeah.
Excellent.
Yeah.
Thank you, doctors. All right, another question. I think the viewer kind of entered a bit late because we have answered the same question. But for the benefit, all right, those others who just came in, okay, let's read again the question. I am a breast cancer patient, one PR positive, HER negative. I did not go for chemo. I just went for hormonal therapy using tamoxifen. I think the question is this enough?
No, there are actually indications on when to do chemotherapy and when to do radiotherapy and when to give targeted therapy. But for the hormonal therapy, you just have to have a positive result for your estrogen or your progesterone receptor. For her case, I cannot comment because I haven't seen her histopathological report. So if she can share with us the histopathological report, then I can make another comment on if she is getting the adequate therapy or treatment for her cancer.
Okay, Dr. Johnson?
Yeah.
Dr. Johnson?
I agree with Doc Jamie. We need more information
Yeah.
regarding her case. Yeah, so I suggest to go for a consult with Doc Jamie and me. But Doc Jamie first, because I'll just support whatever Doc Jamie gives the patient so that the patient can finish the therapy. Okay.
The tandem of Doc Johnson and Doc Jimmy, when you go through them, it's really powerful. I would say we have lots of patients who are coming in here and who have seen by our two doctors here. They are really doing well as of now. So I'm very happy to be close to these two doctors here. There we go. Okay, another question coming from Miss Cheng Rodriguez: is ozone therapy also good too? I'm afraid because I'm afraid to go for chemotherapy. So she's like opting for the ozone therapy over chemotherapy. What's your advice on this, Doc Jenny first?
For me, we can consider those types of therapies as alternative, no? And they are not proven scientifically. As you can see in their advertisement, they're just giving big testimonials on the result of their treatment. So I would not suggest you to undergo such treatment. Okay, listen to your oncologist. Listen to what she will advise you.
Thank you, Dr. Johnson. Would you like to add on that?
I agree with Doc Jamie. Actually, ozone therapy. So the mechanism that they claim behind ozone therapy to kill cancer cells is the production of free radicals. Yes, free radicals might destroy or might kill the cancer cells, but it brings a heavy toll on the body. Okay, since it's free radicals, it's the one that destroys your DNA. However, we do not know how much should you receive to kill the cancer cells. So it's still a question mark for me. Ozone therapy. So it's not easily measured as well. How much dose should you receive? How many sessions? And after you receive such treatment, what are the side effects? And can we still expect what are the expected outcomes? So we do not know that. So I suggest for our patients to not undergo such treatments, and actually it can also be detrimental to your health as well. What I mean is it can poison you before it kills the cancer cells, because the dose might be different. Okay, and we do not know that. So there are a lot of unknown factors here. So yeah, I would advise against it as well.
The advice on this question is for choosing the ozone therapy over chemotherapy. How about, Doc, if the patient is also doing the conventional treatments like the chemotherapy and radiation, would it be already advisable for the patient to undergo such alternative options as well?
Doc Jimmy
Doc Jamie first?
Yeah. As Dr. Johnson mentioned, there are many questionable processes, no, and outcome measurement when it comes to the ozone therapy. So I would still not advise the patient to undergo the ozone therapy even if she's already doing the chemotherapy and radiotherapy. And we do not also know the interaction that will happen if those three modalities of treatment are done, let's say, concurrently.
I see. I think she's just, she wanted to really clarify because we mentioned a while ago having the other supplements, but that's different. Oh, all right. Thank you, Dr. Jansen. Thank you, Dr. Jimmy. All right, another question coming from Ms. Biggs. Are nodules indicators of confirmed cancer, Dr. Jimmy?
Nodules indicator, sorry, no? Are nodules indicator of?
Are nodules the indicator of confirmed cancers?
No. A nodule only means you have a tumor. No, meaning buccal, you have a tumor. But a tumor or a nodule can be benign or it can be malignant. That's why we need the biopsy before we label it as malignant or cancer or benign or not cancer. So you need a biopsy, ma'am.
You need the biopsy. Dr. Jansen, would you like to add on that?
Yes, it doesn't mean that if you have nodules, then that is cancer immediately because we have benign ones, okay? And mind you, the size does not matter, okay? So you need to have the biopsy, okay, in order to know for sure if it's benign or malignant, okay? But of course, we can notice some characteristics for nodules, no, depending on the imaging study that you do. But again, even with the imaging studies, these are just suggestive. Okay, so you still have to go for the biopsy to know for sure. Okay.
Are there instances, doctors, that the person has multiple nodules, but still in the end it didn't really result into cancer? Is that possible?
Yes. Especially for the breast, there are patients, female patients with multiple breast nodules. But by imaging, by ultrasound, or even with mammogram, all of them turns out to be benign in character. So there's no need to do biopsy.
I see. That's very encouraging. But of course, for those of you who are feeling something that kind of like nodule, no, just like what our doctor said, go for a further test just to confirm. It's best to know where you stand, and what your position is. Okay, another question coming from Ms. Deve. What are the signs of stomach cancer? Dr. Jimmy, like to go first.
Okay, the common signs of stomach cancer, or symptoms, not signs, the common symptoms of stomach cancer are epigastric pain, stomach pain, or tummy ache, no? And also, if the patient also has weight loss, also sometimes passing out black stool or vomiting of blood or tarry black vomitus. No? Those are some of the symptoms of stomach cancer.
Thank you, Dr. Jimmy. Dr. Jansen, would you like to add on that? Or?
Doc Jimmy. I think Doc Jimmy has enumerated all. Those are the common those are the common symptoms of gastric cancer. Yeah.
Good job, Doc Jimmy. Good job. Okay. Thank you, doctors. All right, another question coming from Mr. Rolay. Is PPARs contraindicated with arimidex or anastrozole? Are there any contraindications on that, on those medications?
No. Actually, no. Actually, giving PPARs concurrently with anastrozole or letrozole, those are aromatase inhibitors. Those are form of hormonal therapy, and I give them together with those drugs. And I haven't seen any patient who had side effect, who complained of any uneventful incidents with the use of the two. So it's okay.
Thank you, Doc. Dr. Jansen, you might want to share to our viewers tonight that what chemotherapy drugs has PPARs been tested with as well?
Okay. So far, PPARs has been tested with cisplatin, oxaliplatin as well. So platinum-based chemotherapy. So those two types of chemotherapy are known to be toxic to the bone marrow. And Simply Nature PPARs has been proven to protect or to reduce bone marrow toxicity. Okay, so it's yeah. If you're if you're a patient who's receiving one of those chemotherapy drugs, you might want to try Simply Nature PPARs for you.
There you go. Thank you. Alright, just before we go to the next question, I just want to invite everybody, to please don't forget to like and follow our social media platforms like Facebook here, Simply Nature International, and of course our YouTube channel, because we are being simulcast, alright, live on both platforms, the Facebook and YouTube right now. So thank you so much for always watching and supporting our webinars here in the social media. Okay, another question coming from Sammy BC. All right, which among cancers are more prone to surgery? Dr. Jimmy?
Maybe he means which cancer usually undergo surgery as the primary mode of therapy, no? Okay, most solid tumors, maybe I can say it's the breast, since the breast cancer is the most common cancer for women, and it is also the number one cancer among both sexes. So I think the answer would be breast cancer.
Breast cancer. How about I guess a lot of, because majority really of our registers, according to when I checked on the registers now, actually majority are breast cancer patients. So could you share to us, maybe Dr. Jansen, the prognosis or maybe the chances of survival or prognosis of the breast cancer to encourage our cancer patients tonight?
Okay. So for breast cancer, it's actually even curable as long as it's found early stage, no? Especially for stage 0, stage 1, 2. But for stage 4 or the more advanced breast cancer types, the prognosis is still good, especially if it's luminal A or ER/PR positive. But of course, if it's stage 4, then the prognosis will not be as good as the breast cancers with diagnosed at earlier stages. And again, I always tell my patients who are afraid of surgery, if the tumor is not there, if the headquarters of the cancer cells is not there, then the chances of it spreading will substantially decrease. So don't be afraid of surgery, okay? If it's, have the tumor removed, okay? Because if the headquarters is not there, then you significantly reduce the chance of metastasis, okay? Especially for those breast cancer patients who are still in the early stages, okay?
There you go. Yeah. See, that's very encouraging, right? And if you're afraid, come on, go to Doc Jenny perhaps to do your surgery. All right. There you go. Thank you, Dr. Jansen, Dr. Jenny. All right. Another question coming from Miss Mel Liwana. Good evening, Doc. May I ask what is the side effects of imatinib? Dr. Jenny?
Okay, imatinib is another form of hormonal treatment, no? So sorry. Imatinib for that's not for that's for GIS. I thought it's another drug. So imatinib is for GIS or gastrointestinal stromal tumor. So it has many side effects, but the most common side effect is water retention. That's why patients will have edema to legs, edema to thighs. Sometimes the edema can go up to the abdomen. So that is the most common side effect of imatinib. But there are ways to alleviate or to lessen those side effects. So you just have to follow up regularly to your oncologist.
Thank you, Doc. Dr. Jansen, would you like to add?
Yeah, I agree with Doc Jimmy. Yeah. Okay.
Thank you, Dr. Jansen. Okay. Another question. Oh, this is not another question, but I think a follow-up comment on the fecal immunochemical test a while ago. My patient, when he make a poo-poo, there is blood in the stool. Checkup is done in gastroenterologist. She suggested fecal fit test. So there you go. Okay. So I think they still need to further go for
colonoscopy.
Yes.
Colonoscopy, then biopsy as well. Thank you. Thank you. A lot of our patients and viewers are saying thank you for answering our questions. Thank you, doctors. Okay. And also, a lot of them are also asking how to schedule a consultation with our doctors. Please just comment down how to consult. We will get in touch with you, most especially Miss Beth Ama, right? In order for you to be scheduled for consultation with our doctors here tonight. Okay. All right. Your questions are really, really helpful, guys. Thank you for throwing your questions tonight. Okay, maybe this will be our final question for tonight. Okay. Right. A while ago, we've asked, what is the type of cancer that is prone to surgery? The question here is, what is the cancer? It's like the opposite. What is the cancer that is not usually opting for surgery, Dr. Jimmy?
Okay, there are many types of cancer. Of course, there are what you call blood cancers, no, or hematology cancers. So surely those types of cancer would not undergo surgery, aside from the possibility of doing a bone marrow surgery. So there are also other types of cancer that, when discovered, are already very advanced. So most of the time they do not undergo surgery anymore. Just like the lung cancer, which is very common among males, no? Maybe in other countries it's not the same, but here in the Philippines, most of the lung cancer patients are discovered late, at a later stage. So that's why they do not undergo surgery anymore.
Dr. Jansen?
Yep, I agree with Doc Jamie. Blood cancers like leukemia, usually they don't undergo surgery anymore because you cannot actually resect every bone marrow, no, that your body has. Okay, so another one will be, I'll repeat what Doc Jimmy said earlier in our discussion. So non-resectable tumors. Okay, if once you try to resect the tumor, there will be a lot of things that you will remove further, and then you will affect vital organs. Then that will not be an option. Okay, so those types of cases.
Thank you so much, doctors. Right, of course, just before we say goodbye to our viewers, coming from all over the world, okay. Once again, we say thank you to all of you. Please, I'd like to. Can you please give some short parting words, Doc Jimmy first, and then Doc Jansen.
Okay, so to all our viewers, thank you again for giving your time to listen to our discussion. So when it comes to cancer therapy, there are now many available treatment modalities for cancer. We have surgery, we have chemotherapy, we have the hormonal therapy, we have the targeted therapy and immunotherapy. There are also many emerging treatment modalities being studied, just like the cryotherapy or the freezing thawing method of cancer removal. We also have we also have trials on radiofrequency ablation and microwave technology for use in cancer. So you just have to consult to your oncologist and listen to what they're going to advise you regarding the treatment of cancer. Thank you.
Thank you. Thanks, Dr. Jimmy. Dr. Jansen?
I agree. No, there are already a lot of treatment modalities nowadays. So it's actually a matter of taking the immediate action, because with cancer, time is against you. Okay, the more time that you delay, the more that you delay your treatment, then the higher the chances of the cancer spreading, no matter what type of cancer it is. Okay, so I've encountered patients who have had a breast cancer diagnosed in the early stages, stage 1 actually. Then she was quite afraid, no, which is understandable. So she went doctor hopping, and then she wasn't able to get a definitive answer to her question. So with further delays, from stage 1 it became stage 3. So that's the time she underwent the treatments that her onco advised her to do. However, of course, the treatment for stage 1 and stage 3 is already different. Okay, by the time that she is already stage 3, the treatment modalities modalities that the onco prescribed her with would have been different already. Okay, so please do not delay your treatments. Okay, so take immediate action, and if it's still confusing for you, no, go for a consult. Okay, you have Doc Jimmy and I here. Just set an appointment with us. We'll be able to help you. Okay, so thank you.
Thank you so much. Thank you, Dr. Jimmy and Dr. Jack. That was very encouraging, knowing that we have a lot of patients who are kind of afraid to go further, right? Knowing that they feel something inside their bodies, or just maybe find something in their MRIs. Go further and take more actions to find out, okay? All right, just before we go, I just want to, of course, invite everybody. A lot of our patients, our viewers as well tonight, are VIPs of Simply Nature, and as you know, we have an upcoming event this coming September 14, all right, which will be having different segments. We I'd like to say, including Dr. Jansen, of course, he'll be sharing something about physical activities, very particular for our patients, and sharing of course, plant-based diet by one of the famous chefs here in the Philippines, and also doing a little bit of exercise. Of course, very, very light only, because we have a lot of cancer patients joining that event, okay? But it's very special, and we look forward to see each and every one of you to join the said event this coming September 14. That's 7:30. Okay, we'll be seeing the sneak preview after we say goodbye. Okay, so please stand by. Okay, all right. Once again, guys, September is actually a Cancer Awareness Month, and I am very, very thankful to our two doctors who joined us tonight to start off this very important month for our viewers, for our patients out there. And I just want you to all to know that we are here for you. If you, like Dr. Jansen said, if you are confused with what you are dealing with, go for a consult with our doctors here. Okay, they have the tailor-fit suggestion and recommendation for all of you. Okay, all right. So once again, we really hope that we have helped you and we have learned a lot from tonight. I'm very sure of that, and we really hope to see you once again in our next webinars to come, because here in Simply Nature, we are always with you from start to healing. Thanks everyone, good night, and God bless you all.